To clarify the question, sir, after the July 3rd, 2015 incident, but before you brought Maya to All Children's on October 7th, 2016, you had applied for Social Security disability for her, true?
That's a better question, yes.
Okay. Let me talk to you a little bit more about her treatment and try to get the time frame right. You had said that, if I get the sequence of facts right here, that you went to First Sarasota Memorial Hospital after the July 3rd incident, correct?
I believe that's correct.
And then you went to All Children's Hospital, and I think you were telling the jury people threw up their hands and didn't know what was wrong with her, and this was back in July of 2015, correct?
There was a doctor's hospital prior to that.
Okay.
And she was transported.
Right. So the sequence of events, the July 3rd, 2015 incident, doctor's hospital in Sarasota, and because they're not a pediatric hospital, they sent her up to All Children's in July of 2015, correct?
Correct.
Okay. At that July 2015 admission, do you remember what the discharge summary said in terms of Maya's condition and what they were recommending?
No, I don't.
Okay. I'd like to show you what's in evidence joint exhibit 1008-0004. Okay, and on the last paragraph where it starts, the patient was seen. Do you remember, sir, on the second sentence, and this is from the first hospitalization where you said people threw up their hands in the air and said, we don't know what to do. In fact, that you had declined, or Beata had declined, a neurological and psychological examination back in July of 2015. Do you remember that?
No, I don't.
Do you remember in the next sentence that you had requested transfer to an outside hospital? That would be the Lurie's in Chicago. Is that true?
That is true, after she put her arms up in the air.
Well, do you remember that either you or Beata were adamant that there would need to be a PIC line, an IV line put in for the transfer?
I'm unaware of that.
Okay. Do you remember All Children's Hospital telling you that that PIC line would be inappropriate as both an infection and respiratory risk, and it was dangerous? Do you remember that?
Didn't you put one in?
In July of 2015, before you boarded a commercial airline to Chicago to go to Lurie's, do you recall asking for a PIC line then?
I do not.
Okay. Let me ask you about the records up in...
We're reading reports, hospital records now?
I'll ask you about the next one, sir.
Okay.
I actually won't show you this one because it's not in evidence, but let me see if I can understand your testimony. You did not go to Chicago to Lurie's from here, did you?
Beata did. I did not.
Okay. Were you aware when Maya and Beata returned that in Chicago that the discharge summary raised a concern for a psychiatric component to Maya's presentation?
Objection. Facts not in evidence. Lurie records are not in evidence.
Overruled. You can answer.
Am I aware of it? No.
Okay. Beata did not tell you when she returned from Chicago that Lurie's Children's Hospital back in July of 2015 raised the concern for a psychiatric component?
Not that I'm aware of.
Did Beata tell you that Lurie's recommended a therapeutic program that combined physical and psychological therapy?
We did that. That was Tampa General.
Okay. Let me ask you about the Tampa General. You were at that admission, correct?
Yes.
Okay.
One of them.
So I'll talk to you specifically about coming from Lurie's. Then you went to Tampa General from July 2015 until August 2015. Is that correct?
Somewhere in that area, yes.
You were aware then that at Tampa General on discharge, one of the discharge diagnoses from Tampa General was psychological factor affecting physical condition.
And that's when Beata received that call from the nurse practitioner, Bonnie Rice, and that's when she was upset about that.
Okay. And so just, we've asked about what you were aware of and what Beata was aware of. Is what you're telling me that you were both aware that when you left Tampa General, that Tampa General back in August of 2015 diagnosed psychological factors affecting Maya's physical condition?
I was not aware until I heard Beata tell me from that phone call with Bonnie Rice.
Were you aware in August, specifically August 27th, 2015, that Tampa General's recommendation was for intensive physical and cognitive therapy following discharge?
At Tampa General?
Correct. When you
I'm unaware of what I know she got the PT, but I don't know if she received anything yet.
let me ask it this way, Mr. Kowalski. Is what you're telling me in terms of the specifics of what Maya's diagnosis was and the recommendations from Tampa General something that Beata would know and not you?
Beata knows a lot more than I do.
Okay.
You ask a lot of fathers, I'm sure they don't even know where their kid's pediatrician is.
Well, within a month of leaving Tampa General within those recommendations, you had established with Dr. Kirkpatrick in September, correct?
In September, yes.
Okay. And so while Tampa General recommended rehabilitation with cognitive and physical therapy, and incidentally, they did not recommend ketamine, did they?
Who's that? Tampa General? She didn't get better in Tampa General, just the upper body.
Tampa General did not recommend to you when you left Tampa General that you start ketamine, did they?
No.
And yet a month later, despite their recommendations, respectfully, you were at Dr. Kirkpatrick's office getting treatment for ketamine, true?
We went to Dr. Kirkpatrick, after that, but we still did physical therapy on that, and she went to Eagles Wings.
Okay. You agree, do you not, that there is a psychological component to Maya's condition?
If anybody has any type of injury, there's some sort of psychological effect.
You have heard many times, and you've personally seen, that when Maya's with you, she's completely normal, and that when Beata walked in the room, she's in pain.
That's false. There's times she did it for me as well. That's false.
I need to approach on this issue, Your Honor.
You may continue, Mr. Shapiro.
Thank you. With the court's permission, I'd like to play clip 6 from an interview that Mr. Kowalski gave with Detective Graham.
I was told here at the hospital upon her admission, and maybe some of this will shine a light on at home too. When nobody else was in the room but Maya and the staff, she acted completely normal. When Mom would walk in the room, she was instantly in pain.
I heard that many times.
There's no other explanation
Well,
for that.
Yeah, I noticed it too with myself being home, and then Mom comes home from work.
And all of a sudden she's bad.
There'll be changes, yes.
So you're at home, your guys are doing well, playing.
No complaints about pain.
No complaints about
But then
pain.
when Mom gets home,
She's in
maybe.
pain.
Mr. Kowalski, do you recall that interview was with Detective Graham on November 17th, 2016?
I do.
Okay. And everything you said to Detective Graham that day was true, correct?
That is true. And then after reviewing medical records in your hospital notes, it states that she did the same thing for me.
In terms of the timeline, did you go to Mexico when Maya was being put into the coma?
We addressed that earlier. I went to my oldest daughter's wedding, and then from there I took my son back to Florida, and then I proceeded back to Mexico.
Were you aware that the risk of death from that coma was 50%?
There's a risk in every procedure.
Well, I understand that, Mr. Kowalski, but respectfully, there's a risk, and then there's a risk that's a coin flip whether your daughter would unfortunately pass. Did you know that the risk of death in Mexico was 50%?
They stated there was a 50% risk, but they also told us nobody ever died from that procedure.
Are you aware of what complications Maya suffered while she was under her coma in Mexico?
We were informed.
Okay. Your wife blogged about those, did she not?
She had a blog.
Okay. And part of her blog was, you've seen the blogs, true?
No, I have not.
Okay. You're aware that your wife was blogging about Maya's care while Maya was in the coma. Is that true?
Yes.
Okay.
I don't know if you ever had a sick person in your family, everybody calling you, and you're repeating the same story over and over. This was a way of communicating to everybody at once.
After you got back from Mexico, you or Beata took Maya to a Dr. Elvin Mendez. Do you recall that?
I do not recall that, but that name does sound really familiar.
Okay. Are you aware?
Objections, not in evidence.
I'm not publishing it.
Well,
You can continue.
Are you aware that Dr. Mendez on December 10th, 2015, noted in his record that consideration may be given to possible Munchausen's by proxy?
I heard of that after time.
Okay. My question to you is, did Beata tell you that Dr. Mendez wrote in his record as of December 10th, 2015, that consideration must be given to possible Munchausen by proxy? Were you aware of it then?
Not at that time, it was later on.
Okay. Your wife kept notes of Maya's treatment,
She did.
and you were kind enough to turn over. Would you be able to identify her handwriting, Beatus?
I hope so.
Okay. This is not in evidence, but I'm going to ask. I can hand Mr. Kowalski a copy, or we can put it on the screen, whichever you prefer.
Well, if you've got the paper copies, let's use that, but make sure Mr. Anderson sees what you're going to show him first. Mr. Shapiro?
May I approach, Ron?
You may.
The record will reflect that I've handed Mr. Kowalski what we previously marked as Defense Exhibit 3239-0080. Mr. Kowalski, I'll represent to you as well. This was produced by you to my office in response to a request on September 16th, 2019. My question to you is, do you see in the top right corner some handwriting on this document?
You mean top left?
I apologize, sir. Yes, top left.
Yes, I do.
And is that your wife's handwriting?
It appears to be.
Are you able to read what she wrote?
Looks like Sunday, Monday. Yeah, I could read some of it.
And let me ask you if this is what it says. Sunday, 10/2, Maya hurt her foot in BRP. Is that right?
BRP? Yes.
Okay. And then it says Monday, 10/3, Ket IV, 0 availability in office, or it says 0 availability in office, Ket IV out of desperation. Is that what it says?
That's what it. What was the? Oh, unbearable. Okay. Yes.
And it says Ket IV out of desperation, pain was unbearable. Is that right?
Yes.
Okay. I can leave the document with him, or I can take it back at your preference, Your Honor. Those are the only questions on this. You don't recall whether Maya had any skin lesions when she left Tampa General, do you?
No, I don't.
And you don't recall whether she had any skin lesions when she presented to Dr. Kirkpatrick, do you?
That I do not know. That would be in his medical records.
Okay. Maya had not walked from the time of her incident on July 3rd, 2015, until after her discharge from All Children's Hospital in, I think it was August of 2017. Is that right? Sorry. Let me,
Objection.
yeah, it was a confusing question, so let me just rephrase. From the time of Maya's incident on July 3rd, 2015, through when you brought her to All Children's Hospital on October 7th, 2016, she had not walked in that period of time. Is that true?
Objection. Misstates the timetable.
I believe she may have walked when she came home. She was weak. She was carried in. She walked a day or so, and then after that, no.
I wanted to talk to you a little bit about what you described as a relapse in August of 2016. Okay. And
Okay.
this was about the homebound school
Correct.
program. I just want to make sure I understand what you told the jury yesterday. Maya was asked to come to school for an evaluation in 2016. Is that right?
No, that's wrong.
You brought her to school in August 2016.
Yes.
And after being there, Taylor Ranch School said that she had to come back in full-time and canceled homebound. Is that right?
Real quick, there was a fundraiser for her, the lemonade stand. So she went to that. She was sitting in the library. The person in charge of the homebound seen her in there with the kids. And after that, she was denied homebound.
Okay. After someone from the school observed her at the school at the lemonade stand, they then denied Maya's continued homebound. Is that right?
That is correct. And then we had to hire Jane Wisner.
Okay. You hired a lawyer to appeal that decision. And the jury's already seen the letters from Dr. Wassenauer, and there may be one from Dr. Hanna they'll see as well. But the point being, Mr. Kowalski, there was no physical injury at that time, was there?
Object to the long predicates in these questions.
I'll re-ask the
Just
question.
ask questions.
When Maya had her relapse in August of 2016, there was no physical injury at that time. Is that true?
No physical, it was caused from stress.
Let me talk to you a little bit about the decision to go to All Children's. You were already up in Tampa on October 6th getting an infusion with Dr. Hanna, correct?
No, Clearwater.
I apologize. You were staying at the Ronald McDonald House attached to All Children's Hospital, correct?
That is correct.
You were already up in St. Pete, Clearwater, getting treatments with Dr. Hanna on October 6th.
Yes, she was with Beata and I relieved Beata.
The plan was, had she not been admitted to All Children's, she was scheduled for another infusion with Dr. Hanna on October 7th, correct?
That is correct.
You didn't come up here because of a hurricane, did you?
No, she was getting treatment.
Okay. Just if there was any argument earlier in this tribunal or elsewhere that the reason why you were up or brought Maya up to this area from a hurricane or fear of a hurricane, that's not true. It was solely because she was already here getting treatment with Dr. Hanna, correct?
We were here,
Okay.
or in St. Pete, I should say. In St. Pete. We were here in St. Pete.
Dr. Hanna referred you to All Children's Hospital, correct?
No. I was with Maya, and she was in severe pain. I decided to take her there. I knew she had a treatment the following day, but I knew her pain. And you were the closest facility, and that's what I chose.
When you arrived at All Children's Hospital, were you the parent that signed consent for All Children's?
I was the parent that brought her in.
Did you ever, in writing, revoke consent for treatment?
I didn't know I had that opportunity.
Let me ask you about some of the statements or records upon arrival at All Children's. This is Joint Exhibit 1001-18. And as a predicate, sir, were both you and Beata at the hospital at this point?
Beata arrived approximately an hour later. That sounds about right. It takes about an hour from Venice to get to St. Pete. 9:45, I believe she was there.
So by 9:50, the first note, It says an ultrasound was canceled because mother insists she will not tolerate it unless she has, meaning Maya, 1,500 milligrams of ketamine, which I am unable to give in the ED. Were you there when that discussion went on?
I was there, but I believe that's incorrect. She was in severe pain. She had her knees up to her chest. That's why the ultrasound was refused at that time. I didn't understand how you're going to take an ultrasound when she's that much in pain.
Beata was asking for 1,500 milligrams of ketamine, true?
She asked for ketamine. I cannot say true on the amount that you have here.
Okay.
She did ask for ketamine.
And
you did give.
let me ask you about Joint Exhibit 1001-3118. But before we go there, do you know the dose of ketamine that All Children's gave?
Of all children's?
Correct. How
No,
much?
I do not.
Okay. Do you know whether it was dramatically less than what Dr. Hanna had given the day before?
That I'm not a doctor, and I don't know everybody's procedures.
Joint Exhibit 1001-3118. Do you recall at the top, this is also on the day of admission, that mom, meaning Beata, insisted that patient, being Maya, was in severe pain and needs to have more propofol. Were you there for that conversation?
I was there, but I don't recall. I know she asked for the ketamine.
You do know that propofol is a general anesthetic, do you not?
I do not know that.
Okay. Let me ask you about Joint Exhibit 1001-0081. Let me ask you, this is also on the day of admission. Let me ask you if you recall this event. In the middle of the paragraph, the language that starts with, I was speaking to mother. I wanted to ask you about the second sentence. She, which would be Maya, had been attempting to take off all of her monitors. I, being Dr.
Objection to reading medical records. Sauce for the goose.
Sure. I'll have you read the highlighted portion. And my question to you, sir, will be, this sentence and the next one, if you could highlight it as well, all the way through the word staff. My question to you, sir, is, were you there for this event?
I was there, but you have to, I think there's a big key missing out of this, and it was the blood pressure cuff. The blood pressure cuff was a big issue and causing pain. That she did get agitated, yes, you're right, but there was a component that caused that thrashing.
Okay. Let me ask you about Joint Exhibit 1001-3117. And I'll represent to you, this is on the next day, October 8th. Were you there at All Children's Hospital?
Does it say if I was or not? I undetermined if I was there or not.
Okay. And that's part of the reason I'm asking these questions. If you were a witness to some of this treatment, if you knew whether you were there at All Children's on October 8th or not, do you know? I
do not know.
Okay. Do you have any knowledge of the bottom quote where it says 10/8/2016 about mom insisting the propofol not working? Any knowledge of this event?
I do not have knowledge on that. Sorry.
Okay. And again, well, let me ask you about the next exhibit. This would be earlier in the day on October 8th. Joint Exhibit 1001-2721. And it's the second result specifically I wanted to ask you about because it was in the middle of the day. And you had mentioned earlier that Maya refused to have her blood pressure taken. That's true, correct?
Yes, that's true.
Okay. Do you remember Maya telling the staff, quote, "I'll do it if you sedate me"?
Do you realize the pain of CRPS? This little girl knows her pain. She knows what she could tolerate. She needs something for her pain to get a blood pressure. It sounds so goofy to us, but for her, she's in extreme pain and she needs something for that pain before she could tolerate a blood pressure cuff.
But is this a true statement?
If I said that, I'd be speculating, right? I mean,
Let me ask you about Joint Exhibit 1001-639. And I'll represent to you that this is an anesthesiology note
okay.
taken on 10/8/2016 under the part anesthesiology note, and I'll ask you to read the part where it starts the second under additional comments. Family has insisted upon intubation with medically induced coma.
Okay.
Okay, do you remember, it says, which I stated to the father is not an option because we have Maya.
Objection, reading.
All right, I'll stop. I'll let you read this, Mr. Kowalski.
I want to stop you there for a second. We told the story of Maya's history in the triage and in the emergency room. I don't know where they came up with medical-induced coma. We knew we could not get a medical-induced coma in the United States. We're fully aware of that. So wherever this came from, I don't know. That is incorrect in your records there.
Okay. So in terms of what they've documented here upon your request on that day for medically induced coma, you dispute it.
I don't agree with that.
Let me ask you about what's in the record at 1001-2711. And in the middle of the page, this is now on October 12th. Were you aware of these statements from Maya that she wanted to go to heaven?
She was in extreme pain. You ask any CRPS person in extreme pain, a lot of them, as we told you before, this is a suicide disease. A lot of them want to go. They cannot tolerate the pain.
Well, I'll ask you about that in a moment, but the next line says, Mom also states, I don't care how much medicine or side effects. I want her comfortable and out of pain. Is that something you believe your wife would have said?
I cannot answer for that.
Okay. Let me ask you about Joint Exhibit 1001-2719. It's the text result in the middle of the page, text 8851, other during CT scan. If you'll take a moment to read that, sir.
I cannot answer for that.
Okay. You can't tell the jury whether or not this is true, whether Beata had told Maya she would get a reward of Valium if she laid still for a CT scan.
Objection, Your Honor, this is triple hearsay, and we've objected to this before.
What was your question?
Can you tell the jury one way or the other whether Beata was using Valium as a reward for Maya?
At home?
At asking for this at the hospital.
Oh, at the hospital? I wasn't there. I cannot answer for that. But at home, absolutely not.
Okay. Lower down the page, T892, it says there was a family meeting. And I'll let you read it. It says in family meeting, mother stated. I'll let you read it. Let me know when you're done, sir.
I read it.
Do you recall being part of a family meeting where this was stated?
I don't remember this being stated, but yes, I was in a family meeting. You are correct on that. Consult hospice. We were very concerned of losing our daughter.
Mm-hmm. Do you remember the request for consultation for hospice?
I don't recall that. I'm sorry.
Okay.
And I'm not, just there, when you're in that situation, you're very, very overwhelmed. So much going on. I do not recall a lot of that, and I apologize.
Let me ask you next about, we talked a little bit earlier about consent, or what you've told this jury is your lack of consent to stay at All Children's. Okay, so I want to frame for you the time period so it's clear for this jury. You brought Maya to All Children's on the morning of October 7th, 2016, correct?
Yes,
You're aware that by 2:30 in the morning on October 13th, 2016, so a little less than a week later, the state of Florida took custody of Maya, correct?
I wasn't aware at 2:30 in the morning. It was later on the 13th.
I apologize. In fairness to you, you probably found out later that day.
Yes, unfortunately in a bad way.
Okay. The claim that you're making for this jury for false imprisonment, you understand, is from between October 7th and October 13th.
I do now.
Okay. Let me ask you about Joint Exhibit 100154. Okay. Actually, let me instead ask you about 1001-630. I'll represent to you, this is a pain management note by a doctor named Dr. Jenny Dolan, and this is on October 9th, so the third day that you're there, and I'm going to ask you to read at the bottom, not the bottom, but about halfway down where it says, today, Dr. Dolan, Dr. Tepa Sanchez, and specifically the last part where it says, today is day 3 of ketamine and Precedex infusion, and all the way through the end. And let me know when you've finished reading it, sir.
Got it.
This record reflects that you and Beata agreed with this plan of care, true?
We had no choice.
Sir, you agreed with the plan of care being offered by the hospital, true?
We had 2 choices.
Well, let me ask you about the next record, sir. This is Joint Exhibit 1001-620. Actually, let me ask you about 1001-620, yes. This is a pain management note now on October 11th, 2 days before DCF took custody.
Okay.
Do you remember? And I'm going to ask you about the part where it says anesthesiology note. Take a moment to read it, please, sir.
Okay.
The note is accurate. You would agree that you had a chance to discuss the plan of care with Dr. Elliott from the pain management team. Your questions were answered and you understood and verbalized this plan of care, true?
I do remember talking to Dr. Elliott, but I don't recall what was discussed at that time. So I cannot say yes or no on that. I'm sorry.
You're not disputing what this note says, are you?
And I'm not saying that it's true.
Okay. Well, let me ask you about Joint Exhibit 1001-2026. And just the first sentence at the top, where it says actions taken.
Mm-hmm.
You can go ahead and read the first sentence. And for frame of reference, I'll represent to you, this is October 11th.
Okay.
And if you want to highlight it, Clay, SW contacted by medical team. Parents have agreed to stay. That's true as of that date, is it not, sir?
At that time.
Okay. Let me ask you about Joint Exhibit 1001/76.
What about the concern that mother was going to change her mind?
Right. Let's talk about that.
Let's do it.
On October 11th, 2016, you and Mrs. Kowalski at that moment agreed to stay at All Children's.
We had no choice.
Sir, there's nowhere in this record anywhere that says the parents are asking to go home.
Isn't that funny?
noted in the record, you're not disputing that you told the medical team at All Children's that you were agreeing to stay. The concern was that Beata might change your mind, but you were agreeing to stay as of October 11th, true?
Remember that meeting we had? We were told if we left, we'd be arrested.
Let's talk about that. I'm going to show you what's in evidence as Trial Exhibit 2408-1739. Uh, 2408-1739. Do you have that? Let's go to 1738 first, just so we can lay the predicate. This is an email that Beata, your wife, wrote to herself and copied you on October 12th, 2016 at 9:27 p.m. Do you see that?
Yes.
Okay, and just for verification, at the top, that is her email address, correct?
Yes, it is.
On the second page, let's go to 2408-1739.
Is this in evidence?
You moved it in, I thought they moved it in today.
Is this in evidence?
You put it in evidence this morning, sir.
Which one?
That's a double page.
Let me see.
The clerk says this one's in evidence.
Is or is not?
I'm sorry?
Is?
Is.
Is.
Okay, Clay, you can put it back up, 2408-1739.
Okay.
Let's talk about halfway down the page. It says Tuesday, 10/11, late afternoon. The same woman from CPS. Incidentally, that's Sally Smith, correct?
I do not know.
Okay. Well, let me ask you about this. She received a complaint that we wanted to take Maya AMA, that's against medical advice, and take her home. That's a lie. That's what Beata wrote. True?
Not at first. She wanted to go to Nemours.
Sir.
Or she wanted to go to Dr. Hannah for treatment.
On Tuesday, October 11th, 2 days before the state took custody of your daughter, your wife sent you an email and copied herself that specifically said that she was disclaiming, she was disputing the allegation that you and her wanted to take Maya out of the hospital.
And to take her home. She wasn't going to take her home.
She was not, she agreed to stay at All Children's Hospital as of October 11th. She was disputing the allegation in an email to you that she was trying to leave against medical advice. That's what this says, does it not?
That's your interpretation.
Okay. Let me ask you about Joint Exhibit 1001-73. This is the next day on October 12th.
Okay.
Under the interim history at the top, I'm going to ask you to read where it says they reviewed all of the patient's medical records to the, that's fine, you can leave it there, but what I'm focusing you on is halfway down where it says they reviewed until the end of the paragraph.
Who is they, first of all? I'm sorry.
They is you. At the end it says, this was discussed with the mother who's in agreement with the plan.
Objection. Again, reading the record.
This, I'll back up. It says, this was discussed with the mother. The mother agreed to proceed and the patient will require go lightly clean out. At the end it says, this was discussed with the mother who is in agreement with the plan of care. Isn't that true?
Yes and no. We were told if we left, we would be arrested. So we had to follow your guide.
You can't tell this jury who told you you were going to get arrested. True?
No, it was in the meeting, and it was somebody within that meeting. one of your staff,
After All Children's, well, let me ask you this. You were asked some questions about visitation. After Maya was taken into custody by the state of Florida, you understood, sir, visitation at All Children's could only happen pursuant to DCF approval. True?
It had to be supervised is what we were told.
On October 16th, 2016, you specifically responded to a request to DCF where they asked you, who do you want on your approved visitor list? True?
There was a list for supervisors, and then there was nothing in reference to like the priest and things like that. No.
I'll ask you about the priest in a moment. But do you recall, sir, that on October 16th, 2016, you wrote a letter to the child protective investigator with the state of Florida? Her name was Lindsay Massick.
Yes, I do remember that. Social security numbers on there?
Yes.
Yes.
Because DCF required all visitors to go into All Children's Hospital to undergo a background check, correct?
Correct.
And they asked you, can you please provide us, meaning DCF, with a list of people that you would like to visit Maya?
Yes.
And then DCF was going to run background checks, correct?
That's what they were supposed to do. And then my brother, Bob Reines, he called. And
Well-
they said the hospital will not allow him because he's a family member. The hospital will not allow it.
But you don't know, as you sit here today, whether that denial was because DCF had not approved him versus All Children's not getting word from DCF whether he'd been approved, do you?
This is hearsay, but he could contest to it. He has a letter, and he also spoke with her, and they said the hospital is controlling this, and they should not be doing it.
All of those decisions on who could come and go at the hospital after October 13th, to your understanding, was under the jurisdiction of DCF approval, true?
I just told you it wasn't.
Well, let me ask you about, and just, this is not in evidence yet, but I would ask Clay if you can show him only.
Well, no.
Sorry. Well, let me ask you a question first. Let me lay the prayer. Do you remember that on October 27th, 2016, you wrote a letter complaining about the church people coming to Maya's room who gained access to a room without your approval?
Not without my approval. What happened is, I believe it was Tori Nellis. She
was with
stated that there was some visitors, not only the church people, but there was somebody else that came in and gave a gift to my child, and then also the young lady that runs the Ronald McDonald House. She said, if these people come in anymore, I'm going to lose my visitation privileges. I was highly concerned, and I did not know about the church people. I had nothing to do with that. So yes, I did write a letter to my lawyer, Deborah Salisbury.
Because you were working with Tony Niehaus, was with who?
Tori,
Tori was with who, sir?
one of the third party, whatever, Safe Coalition or whatever, I don't know.
With the DCF Safe Coalition group, true?
Somebody like that.
And your complaint was that you didn't understand how they were able to access Maya's room without your permission, true?
I was concerned not only for them, but the other people that went in there as well.
You
I
did-
did not want to lose my privileges.
You didn't authorize them to come to Maya's room either, did you, sir?
I don't have that authority.
Let me ask you about, you were asked by your counsel about some transfer diagnoses, okay?
Yes,
You're not denying to this jury that as of November, after Maya was sheltered by order of the state, in early November, you and your wife had the opportunity to consent for Maya being transferred out of All Children's Hospital, but you and Beata refused.
that is correct.
Let me ask you about one of the other documents on that issue as well. Well,
And that wasn't you and Beata. Beata refused. I remember that.
okay. But just so this is clear, in November, Maya could have left All Children's if Beata had said yes.
She could have, but we weren't going to do it under that diagnosis.
The diagnosis code that had already been made at Lurie Children's, Tampa General, and at Dr. Mendes' office, true?
Objection, those are facts not in evidence, misstates the evidence, and if we're going to
Sustained.
have him comment on it.
Sustained. Correct. Mr. Shapiro, you may continue.
Mr. Kowalski, just going back to the decision to stay at All Children's back on October 11th, so 2 days before shelter, you do admit there was a meeting with the doctors where Beata wanted to take Maya out, but you said, hold on, time out, and you asked the doctors, what time frame are you talking about? And when they explained, you said that's doable. And your wife wasn't happy with what you said, but you were upset that the hospital didn't write that down. Is that true?
Objection, compound question, multiple.
Sustained.
Okay, let me break it down. You agree there was a meeting with the folks at All Children's and you and Beata on October 11th, correct?
Yes.
And you agree during that meeting, Beata suggested taking Maya out of the hospital, but you said, hold on, time out. True?
True. And because we had no choice. They gave us word we're going to be arrested.
Okay.
So it's like, calm down, Beata. We have to do something here. So
Well, that's not what you said. What you said when the hospital told you on October 11th what the plan was, you told them that's doable. True?
we had no choice to be.
Your Honor, if I may approach. Mr. Kowalski, to clarify,
Yes.
again, on October 11th, you were at a meeting where the doctors told you the time frame of how long they wanted Maya to stay, correct?
I don't know the time frame.
Well, you told the doctors, after they told you on October 11th, they wanted to keep Maya, you said that's doable, correct?
There was some argument there, so
Well, you were upset when you found out that that conversation with you giving consent on October 11th to stay was not documented in the record, true?
I'm getting confused here now. Say that question again, please.
After you gave your consent at this meeting for Maya to stay at All Children's on October 11th, when All Children's told you the plan of how long they wanted there, and you said that's doable, when you found out that that conversation of you giving consent wasn't in the record, you were upset by that, true?
Objection, compound.
Overruled.
Vague.
I was upset or Beata upset? I didn't understand what.
The conversation where you gave consent to stay on October 11th, you were upset that that conversation of your consent wasn't recorded in the record on October 11th, true?
I don't know if it was the consent. What was I talking about earlier? That was not. It was about being arrested. That was not in the report. That's what I said before.
Your Honor, I'd like to play for impeachment clip one of the audio.
When I replied to
I don't think so
her,
at this time.
Okay.
it
Well,
was in reference to being arrested.
Sir, there was nothing. Let me ask you this. Do you remember when you sat down for an interview with Detective Graham?
I do not. Oh, Detective Graham? Yes, I do.
On that interview with Detective Graham was on November 17th, 2016, correct?
I would have to look at the date, but somewhere in that area.
I'll represent to you.
Okay.
It was, and Detective Graham was one of the investigators with Sarasota County, correct?
I'm aware of her.
Okay. Do you recall having a conversation with Detective Graham where she asked you about whether you were supportive of keeping Maya at the hospital?
I would have to see that, but there was something I'm supportive of getting Maya better. I remember, yes.
Okay. Well, did you not tell Detective Graham that you were at a meeting with the doctors one day and Beata wanted to take Maya out, sign her out, and you said, hold on, time out?
Objection, this is reading in the
Sustained.
Okay. Do you remember telling Detective Graham that you were in support of Maya staying at the hospital as of October?
Same thing.
Okay, overruled on that one.
Yeah, I'm unaware of that, to be honest with you, but I know things were talked about, but I do not recall that part.
Well, let me just ask you this while the jury's here. Are you disputing that you gave consent for Maya to stay in the hospital on October 11th after having a conversation with the medical doctors where you told them that's doable? Are you disputing that?
Like I said, sir, that we were under certain things we had to follow. I do not recall that part.
Okay. You're not disputing, are you, that on October 11th that you gave consent for Maya
I'm
to
not
stay?
saying yes or no.
Objection, let's ask and answer the third time.
You can finish, Mr. Kowalski, your answer.
Okay, yeah, that I'm unaware right now. I'm sorry.
Well, even as of November 17th, 2016, you were receptive to keeping Maya at all children's. True?
She was under state custody at that time, and then we refused the transport because of the coding.
Wasn't my question to you, sir. Even after state custody, on November 17th, 2016, you were receptive to keeping Maya at All Children's Hospital.
Do you
True?
have something to show me to help back that up? I don't know where you're going with this.
Okay, I'd be happy to play that
Yeah,
for
please.
you, sir. Clip 4, please. Well, sorry.
Wait a second. Are you asked, is this for refreshing the recollection? 'Cause if so, just show him the transcript.
Which depot was this from?
This is, I didn't ask for my apologies.
There's 5 depots, so which
No,
one?
this is from your interview with Detective.
Oh,
Graham.
okay. That's what it says there.
Well, I understand that's what it says, sir. It's true, though, is it not?
Well, I can't, it's there, so.
Respectfully, Mr. Kowalski, you told Detective Graham while Maya was sheltered at All Children's Hospital that you were receptive to keeping there even as of November, true?
That's what it says, but that interview was extremely, very, very difficult to get through. She was, you heard the tape.
You didn't
Let
lie?
him finish, please.
Sorry, go ahead, sir.
I was under a lot of stress. I didn't know where she was going with that. You know, but I do not recall that, but that's what's in the writing. I must have said it, yes.
Okay. So what's clear to this jury, you admit that you told Detective Graham on November 17th, 2016, that you were receptive, even at that point, to keeping Maya at All Children's. You're not disputing that, are you?
I'm not
That's
disputing.
irrelevant. The decision already been made. I move to strike.
Overruled.
Let me ask you about some of the bills that you were asked about.
Yes.
When did you first review the bills from All Children's?
The bills would have been after Beata's death, I would imagine,
Okay.
because she's the one that handled the bills.
So just to be clear, the bills that you reviewed from All Children's that your counsel walked you through, you would have reviewed after your wife's death, true?
Yes, I didn't. It was. I had no idea where she kept all that, and it took some time.
Okay. At the time you reviewed them, did you believe the CRPS codes were true and accurate?
On the billing,
Yes.
it's state CRPS on there.
Let me ask you a little bit more about that. In Clay, it's Joint Exhibit 2017-663. You might be able to enlarge it for us.
Thank you.
Okay. This bill that you were shown, you see that the services rendered included for endoscopy, true?
Yes.
They included for nutrition.
Yes.
There are, by my count, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 diagnoses codes that were submitted as part of this bill. True?
Yes.
Among those were CRPS and child neglect or abandonment, among others. True?
I see that.
Sir, can you tell this jury what percentage of the $5,980 was paid for CRPS?
I don't see where the percentage would be.
Well, it doesn't say it.
Okay.
And I'm not trying to trap you, but the allegation that all children's billed solely for CRPS treatment, that's not what that says on this bill.
When that question was given to me, I believe he asked what was if that diagnosis was on there, or what do you see on top?
Okay. All Children's Hospital was paid for the bed while your daughter was being sheltered there. Are you aware of that?
The bed, you said?
Correct.
Objection, that's irrelevant on that point.
Okay. Are you aware, sir, can you tell this jury at all what percentage of the $5,980 Aetna reimbursed was for child neglect versus complex regional pain syndrome versus a throat infection versus immunoglobulin versus constipation versus abdominal pain, etc.?
That I could not.
You can take that down, Clay. No one at All Children's Hospital ever told you that Sally Smith was an employee of All Children's, true?
No, and nobody told me that she wasn't.
All Children's never told you that Sally Smith was their employee, correct?
No, but she was wearing the same lab coat.
I'm asking you, so that's a no, correct?
I said no.
Okay. And in fact, your wife knew who Sally Smith worked for, right?
I cannot speak for that.
One moment, please. We could do joint exhibit or trial exhibit 24081739. And it's in the about 2/3 of the way down the page. It says Tuesday, 10/11 Eve. I had another supersized visit. This was the email we showed earlier that Beata wrote to you. True?
Where does it say it went to me?
It says, do you want to see the date of the email again?
Please.
Okay, Clay, let's go to the first page, 1738. So I'll represent to you, this was...
Yeah, I see it.
Okay, so let's go to the next page, 24081739. Tuesday, 11 Eve, I had another supersized visit from MD Dr. Smith, who was sent by CPS to investigate this possible child and abuse and neglect case. That's what Beata wrote to you.
Okay.
Okay. Let me ask you about sir, and I apologize for having to raise this. You did have plans to have Beata move out, true?
Yes, that's true.
You had prepared divorce papers?
No. It was a legal separation.
You told Detective Graham that when Maya was released from the hospital, you would have Beata move out. True?
That was the plan.
And divorce papers were prepared.
We were going to do a legal separation.
I'm going to be as sensitive and brief as I can on this topic, sir. The hearing on Friday, it was Friday, January 6, 2017,
Yes.
that you talked earlier, Beata was very upset about being separated from Maya for now almost 3 months. True?
She was suffering. Anybody that would be removed from their daughter would be like that.
Okay. The 3-month separation of Maya from Beata was what was causing her this emotional heartache. True?
Most of it.
That night, you do recall Beata left with a gun. True?
That was my thought, but that was untrue after time.
Okay. You reported to the police that night that Beata had left with your gun.
I reported Beata missing and potentially, well, I said the gun's missing out of the safe, but it was in the house.
You did not believe she was suicidal that night, did you?
I was very worried about Beata. I called her family, but I was concerned when the gun was missing, but it ended up finding the gun in a long time after. She never took the gun.
But on that night of December 6th, you were not concerned that Beata was an immediate suicide risk, were you?
I was concerned that she was missing. I was concerned about her health. I called her family after she was denied in court. Her brother did fly in, but she did come home.
So that's a no. You were not worried about an immediate
I was
suicide.
worried about her. I told you I was always worried about
I
her.
wasn't asking if you were worried about your wife, sir, respectfully. I was asking if you were worried that she was at imminent risk of suicide.
Well, when I didn't find a gun, I was very concerned, and I called the police right away.
Beata never expressed suicidal ideation to you at any time, true?
She never mentioned suicide whatsoever.
And then the next day, which would be the 7th, now Saturday, January 7th, I think you said you and Kyle had gone out to a party. Is that right?
We went to a neighbor's house, a birthday party. Beata was going to go with. She had a migraine headache. That was the day after she was missing, and she came home that night. She stated she had a migraine headache. She was in bed. She did get up to wrap the present for the child. We went to the birthday party, and when we came home, the door was closed where she was sleeping. So Kyle and I, sat on the couch. We watched TV. Kyle fell asleep on the couch, and then I shut the TV off and went into my bed. At that time, she was sleeping with Kyle. That was like her little security blanket. That's all she had was that little guy. So that night, her brother, like I said, I called because I was concerned about her.
Yeah, and so just to make sure I understand the question, when you came back, you didn't check on her because you did not think she was suicidal at that moment, did you?
No, she stated she had a migraine before we left, and I let her sleep.
Okay. So, and again, just so the jury understands, at no point during this process did you believe that your wife was at imminent risk of suicide, true?
I was always concerned about her.
I'm
But
not
yes,
asking you
yes,
for
it's
consent.
true. I was always concerned about that. With all that was going on, yes.
But Beata never expressed any suicidal ideation to you in November, December, or January. True?
November, December, January. There was a report from the hospital that she, in your records or in Sally Smith's records, that somebody within the medical.
Sir, I'm asking you about report to you.
Can he please be allowed to answer the question, Your Honor?
It's non-responsive to my question. My question was very simple.
I agree. So why don't you ask your next question?
Okay. My question to you, sir, was this. Did Beata ever express any suicidal ideation to you in November 2016, December 2016, or January 2017?
She never told me that she was going to take her life, verbally.
The jury earlier saw one of the suicide notes. Do you know why Beata said, I give rights of my parental rights of Maya and Kyle to my sister and brother in Chicago?
No, I do not know.
Let me ask you a little bit about Maya after she got out of All Children's. We had a chance to talk to, at least my partner, Mr. Hunter, did, in November 2019 to give you an idea of time frame.
First depo.
Yes, sir.
Okay.
At that point, so now we are a little over 2 years after she got out of All Children's Hospital. Other than allergy medications, Maya was not on any medication, correct?
Not that I'm aware of. I would have to review that.
Okay. She had not seen anyone for asthma in over 2 years, true, by that point?
That's true, and hopefully, like we said, ketamine and hopefully the hyperbaric chamber did help for that.
Okay. Well, to be clear, after she got out of All Children's Hospital in January of 2017, she's never received any ketamine, has she?
No.
And she's never gone to hyperbaric medicine, has she?
No.
In fact, as early as 2018, you were able to scuba dive with her.
She scuba dived, but with her arms.
Okay. Well, she was back in school the next following year,
Yes, on crutches.
and she became president of her class. True.
That is true.
She was waking up at 4 a.m. Running in the morning.
Running?
She was
Not
exercising
running.
at 4
She
a.m.
exercising.
Okay. She, as of that point, at least when you talked to my partner, Mr. Hunter, you did not see any signs of CRPS in her at that time. True?
At that time.
Okay. And again, when we talked to you in October of 2020, you saw no signs of CRPS in her at that time either. True?
No, but unfortunately there are signs now.
Okay. Well, let me ask you, Maya has been able to get a job working at Cracker Barrel?
She worked there. She waited tables, and she had somebody carry the heavy load.
She got back to ice skating?
For a short time, yes.
She has no physical limitations right now. True?
I wouldn't say true. She knows her physical limitations.
She was back in phys ed class.
The what? I'm sorry.
Physical education class. She was able to get back into physical education class without restrictions. True?
True, but she had problems running.
And again, in that period of time, within 2 years after she left All Children's, from your observations as her father, you did not see any signs of CRPS, correct?
It never went away, just so you know. There was pain here and there. It's not like it was a clean slate. So I would say untrue on that.
Okay, well, let me ask you about that. When you were asked on November 6, 2019, what signs or symptoms do you see of CRPS in her today? You said, I don't see signs, no evident signs. She's not complaining of pain. Her muscles are built up. There's no lesions. I don't see nothing right now.
That is correct. And I don't know if you heard earlier, she hides a lot from telling me as well.
One moment, Your Honor. Just a couple more questions, sir. The
Famous.
Yeah, true. The photographs that we saw earlier
Yes.
of your daughter, Beata had not seen those before she died, correct?
I wouldn't say that's correct. She would have seen some of them, yes.
No, okay, so just to be very clear, the photographs that were taken, the date that Maya was being brought to court for the DCF dependency hearing, Beata had not seen those before she passed away, correct?
No, but she heard about it.
Well, you had not.
I have not seen them as well.
Okay, you had not seen the photos, and she had not seen the photos. True.
Correct.
One moment now. Those are the questions I have. Thank you, sir.
Thank you.
Redirect.